I'm a strong believer of early intervention in myelofibrosis, and there's many dimensions to that statement. So early intervention could be interfering with active agents early in the course of the disease, or at an earlier phase of the disease, a lower risk disease, or by applying more intense or combinations early on in the disease to result in a faster and deeper and more quality response in patients. There are many examples of this that have shown that introducing active therapy early in the course of the patient's outcomes can result in different courses of the disease and different patient outcomes and clinical benefit. So we continue to explore this, and our more modern clinical trials are truly providing intervention at earlier phases of the cancer, and hopefully resulting in more impactful effect on the cancer.